Lynda.
I'm Sami.
I'm Cassie. We're here to talk about your diagnosis of atrial fibrillation. We just kind of want to talk about what to expect and some other complications and signs and symptoms to watch out for.
So as you know, you were diagnosed with something called atrial fibrillation, and that was probably diagnosed by that electrocardiogram or those stickers that they placed on your chest, and it measured like the electrical connectivity of your heart. And so what atrial fibrillation is, it is where the top parts of your heart kind of quivers if the electrical connectivity is not working properly. So the bottom part of your heart is not pumping at the same time as the top part of your heart in sync, so at the same rhythm. It can cause a blood clot that could possibly break off. That blood clot could travel up through your arteries into those arteries in your neck, which could potentially dislodge into your brain, which would prevent oxygen and blood flow from reaching that area of your brain.
Some symptoms that you may notice with AFib, your heart may feel like it's racing. Even when you're resting, you may feel like you have some shortness of breath, feeling tired or weak, swelling in your ankles and feet mostly, feeling like your heart is racing or skipping a beat, or some people say flip-flopping in your chest, chest pain and dizziness and lightheadedness. So when you're moving, just be careful. Move slow, get up slow.
So as Lynda mentioned, that atrial fibrillation can actually cause a stroke in some patients. So we just want you to watch out for some of the signs and symptoms of a stroke. So we like to use the acronym Think Fast. The F meaning face, so you can see a drooping face or a drooping eyelid. You can also feel some numbness and tingling in one half of the face. For the arms, or the A stands for arms, you can also see some numbness and tingling. And it can be difficult to lift a certain arm or limb. So you definitely want to test those side by side to see if you are having that difficulty. The S stands for speech. So your speech can be a little bit slurred and it may be hard to communicate, or you may not be able to communicate at all. The T stands for time. So a stroke is a medical emergency. It's something that you want to get checked out right away. And if possible, we would love it if you could note the time of the symptoms and when they started, just because we do use a drug to bust that clot and break it up, and it has to be administered within 4.5 hours of those symptoms starting. A couple other symptoms of a stroke are a change in the level of consciousness. So this can be confusion, some problems with judgment, and some problems with attention span. So,
yeah. So the doctor will be in a little bit to talk to you a little bit more about this, but we just wanted to give you some information and stuff to look out for.
All right.